Hey everybody, welcome to On the Block with Bryce. Today is part 2 of our 2-part interview with my friend, the nurse. If you missed the one from last week, be sure to tune into that one as well. This week we dive right into the deep end with all sorts of heavy and controversial topics, up to and including personal responsibility for your health, treating trans patients in light of the trans movement, euthanasia, medical marijuana, abortions, anti-vaxxers, and even prostate milking. Yikes. Not a long intro this week. I will have a separate post for show-related news coming up sometime today, so be on the lookout for that. I'm super excited to have you be part of this conversation. As always, share with your friends, leave comments, and now, enjoy the show. All right, so I've asked you a ton about hospitals, interworkings of them, how everything goes down in the offices and hallways of where you work. But let's talk about the actual reason why you do your job, the people, the patients.
Yes.
Obviously, you have a lot of crazy stories.
I do. Way too many. That's like literally maybe like 10 other podcast episodes. Like
exactly.
One per episode.
Yeah, we could do one per episode for a while. But I'm sure you notice a lot of trends that people talk about that are very obvious, that you see day to day, that you could probably give a lot more insight on. And the biggest one that I want to start with is people's own self-care or lack thereof.
Oof.
We have pill addictions. We have people who don't take care of themselves like knowingly. Yeah. Like they know they're on their way to diabetes and they eat like shit anyway.
Yes.
How much of this do you really see on a day to day, week to week?
Right now, since I've been in oncology,
right now it's a little different.
But before, oh my God, daily. I mean, I would have patients who would come in with blood pressures of over 200. It's insane. And it's like they absolutely know that they need to start taking medication. They just choose not to because, in their own words, they want to take care of it themselves. Yet they do nothing to improve their own health. And it's kind of sad to see because it's like you're giving them the resources. You tell them like, hey, if you don't want to take it, like there's certain things you can do. And there is. You can exercise, eat better. You know, there's literally so much you can do. However, they choose not to. And we've had a lot of patients who unfortunately have gotten to the point where they get really bad diabetes. They've had limbs being amputated because of the fact that they don't take care of themselves. Like,
what causes that in people, do you think?
Like causes them not to take care of themselves?
Yeah.
Honestly, sometimes it could just be cost.
Okay.
Sometimes it really could be cost. And unfortunately, people just don't have the money to take care of themselves. Sometimes it's just because they don't want to take the medication. It's not that they can't afford it. It's just they just don't want to take it.
Well, I'm one of those people. Like, I won't even take Tylenol if I got a headache. But I do think there's a certain point where it's like, look, we're in the 21st century. Modern medicine has come a long way.
Definitely. If
you're at a point where it's like, look, do this or things will get worse, including and up to your own death, like, for fuck's sake, take the medication.
Yes, absolutely.
Even if it's just temporary.
Yeah.
And I feel the same thing about like morphine too. The problem is people take it too much and they get addicted to it. You, not now in what you do in oncology, but before.
Yes.
You see a lot of pill addicts, right?
We do. I definitely have. And I came across one that was a really, really bad, like, I mean, it would be to the point where he would come into our office and he'll be like, I'm going to kill myself if I don't get my prescription like filled. And I mean, it was insane. Or his mom would call us and, you know, as a nurse, we take a lot of calls and we try to give them, you know, nurses hotline or whatever. However, they like, no, this is my doctor. Like, you know, I could hear my patient, the same one. He would, his mom would be calling and he would be in the back screaming, like, I mean, yelling at the top of his lungs. I couldn't even hear what the mom was trying to tell me because he was just yelling so loud. And then, you know, and then his dad would be like, he's literally going to kill himself if you don't give him the medication. We're on our way right now for the doctor. Like, it doesn't work that way. It really does not work that way. And I mean, we've had to like call the paramedics. We've had to call like police because like there's time he came in, you know, holding a knife because, you know, he needs a medication. And he wasn't going to hurt any one of us. He was definitely going to hurt himself. And that's obviously the number one thing that we're there for. We're there for care. That's our main goal. However, we're also there to make sure nothing for us happens.
Sure.
So, you know, like my doctor, he was very. That's the one patient that I would say my doctor is at the point where he's like, fuck it, just give him whatever he wants just to get him out of there.
Well, yeah, that was the question I was going to ask. Like, obviously, there is a medication epidemic in this country. People are on meds like a motherfucker.
Yes, it's like candy.
Mostly unnecessarily.
Mostly unnecessarily.
Mostly. You have pills being marketed on TV.
Yes.
All the fucking time. I already think I know the answer to this, but I just want your opinion. Like, who's at fault here? Because you have the addict, you have the insurance company, not the insurance company, you have the pill manufacturers who are pressing a product.
Yes.
You have the doctors who are just like, fuck this, give them whatever they want.
Yes.
Like, you see a lot of this. I would say it's a mixture of all things, but
it is.
In your professional opinion, again, like,
it is a mixture of
who
all
would you
things.
point the finger most at?
Definitely a trifecta for sure. However, it's hard for me to say I would pinpoint all the blame on the doctor or the person who's prescribing. However, they can choose not to prescribe the medication and the patient can choose to find another doctor to give them the medication they require.
Yeah.
But they don't want to lose that patient because that means that they're losing money.
I see.
So we did have instances where that same patient would say that. And my doctor, I have to give him a lot of credit because he was one of those amazing doctors. He would really try his hardest not to give it to him. However, if it was pressed to the point where like the people from corporate will call me, like, just give him the medication, whatever, it's really not his call to say no. Not if he wants to keep the job where he's at right now.
I see.
He can say no.
Is it kind of like a quota?
It's not a quota, not anymore, because remember, the insurance has changed their perspective. So it's really not, it's not that. And actually they definitely keep track of how much antibiotics and how much pain medication you're prescribing. Because
if you're talking like big pharma pushes a product, they would definitely want to see it in circulation.
Absolutely.
So it would be really easy to imagine that doctors are pressed to give out certain meds. Does this happen still a lot?
Not a lot. I'm going to give you an example. Remember, where I used to work before, I had 4 other doctors that I worked for. One in particular, he was off the bat up front with all the patients. I don't prescribe narcotics. Don't ask me for narcotics. I will not prescribe them. That doctor, I mean, he would have patients that will leave him because he wouldn't give them, and he was like, I'm fine.
Fuck it.
Whatever. He's like, I'm fine. He's like, I'm fine, but I'm not going to change my ethics just to bring money to the company. So there are doctors that can, and they choose to not prescribe anything because he can. He's a doctor. He's actually a DO. So he's more licensed than an MD. DOs make more money. They're just they went more to schooling, so they have more calling the shots, I would say. So he chose like, hey, you know what? I'm not going to, and that's from his personal ethical beliefs. So there are doctors that can choose to not to give it, and there are some doctors who just give it out like candy.
I mean,
like,
definitely.
Yes, I had a doctor who would literally prescribe insane. Like, why would you even? There's no reason for you to prescribe, for example, a narco medication if you're coming for a cough. There's just that just makes no sense. And like, we would call him the narco doctor because I mean, he would give narco for every single little thing. It's like, okay, like you don't even make sense.
Dr. Narco.
Yeah, like exactly. Like that just doesn't even make sense. And for us, like we would be like, we would raise the question to like our manager because we could not raise it to anybody else. Like, hey, like there's no need, there's no point. Like there's literally no reason for it. And that's when you kind of start seeing like the doctors. Because it's like, why are you prescribing it? You know what I mean? Like, what's the point? Like, that's where the doctors is kind of like, okay, the doctors are the ones who kind of are creating the addiction, because it's like you don't need to give that particular medication to a patient, yet you're giving them. They're going to take it because they're instructed to take it, and then they start getting hooked on it, and then they need more, and they need more,
and then the cycle continues.
So it's just it really depends on the doctor. You will definitely get to see your doctors as you see them kind of like unfold. I've worked with one doctor who was straight out of med school. He was a great doctor. Really, really smart, really smart. And he would be very, very, very cautious of who he would give medication to, even normal medication, just because, I mean, this is the license and your license is literally what's paying you. And once you fuck that up, I mean, you fucked it up.
Yeah. What else are you going to do?
Yeah. Like you're done.
I think people should definitely be responsible for their own shit.
Yes.
I probably wouldn't point at all at one person either, but I do think you bring up a good point. Like, people should be responsible, yes, but we have a trend going on right now where they're not.
Yes.
You're not going to see medication companies stop promoting their medication.
Absolutely
That's not going to happen.
Absolutely not.
So somewhere down the line, somebody has to say, wait, no, we're not going to continue this pattern. It would be great if people themselves could sit there and just, when they see a fucking medication on their TV, just turn the channel and be like, no, fuck this. But, I mean, you might be right. It might be in the hands of medical professionals at the start to create this trend, because laws don't really help you, I don't think. I think you just have to change as a whole. As a society, you have to sit there and be like, no, we're not going to do this anymore.
Yes.
And it might be a good idea for the medical professionals, the people who know this shit inside and out, who know your body probably better than you do as far as like what's going on and why.
Absolutely.
To maybe sit there and be like, yeah, no, we're not going to do this. And maybe that is the start of something. Perfect world. People take responsibility for their own shit. I don't think it's fair for doctors and nurses to have to sit there and babysit people necessarily.
Yes.
Care for them, yes, but babysit their bad habits, no. But let's be real. That's not the world in which we live.
No.
Maybe it can get there.
Yeah, it can. I mean, again, this is where we do a lot of education for our patients. We educate them on how to treat themselves, on how to, where I used to work at wound care, we did obviously we would instruct our patients like, hey, this is how you take care of it. There were patients who would be very diligent and would do it on their own. And then there would be like some that would come on a daily basis because they didn't want to do it. It's not that they couldn't. They just didn't want to do it.
Right.
And it's like, if your insurance is going to pay for me to do it for you, why are you not going to come to my place so I can do it for you?
Right.
So it's really, it's kind of like, again, a trifecta. It could be, it's the insurance, it's the patient, it's the doctor, it's also the nurses. Because for me, I'm a very, like, again, very, very careful nurse. I'm very, like, gentle as much as I possibly can. And there's sometimes that you can't. And, there are patients that request for me in specific because, like, oh, hey, I like how she, like, took care of me, or, hey, I like how she gave me the injection, or, she didn't bruise me at this particular thing. So it's definitely also our fault too. If we give the utmost care, they're going to want to come back and be like, hey, you know what? You did it good the first time for me. I shouldn't have to do it. You can do it for me. And as a nurse, we can't say no. That is our job, and that's what you're here for.
Well, that kind of, I wouldn't put that so much on the nurses, though. I mean, your job is to provide good care. If they come back and don't want to take care of themselves, I mean, that becomes on them. Yes,
and then for me, I've had a patient who, like, we instructed her on how to take care of herself. We told her, like, what to do. Like, we're like, hey, if you don't take care of this, the repercussion is that you're going to lose your foot. And patient was aware, when we have things like that, we have them sign consent forms letting them know, like, hey, we instructed you what to do. This is what you need to do. If you're not doing it, that's something that needs to fall on you.
Yeah.
And again, this is to take heat off of us.
Right.
So the patient, long story short, a patient came in maybe about 4 days later, and she had to have her foot amputated within those 4 days.
Bitch, we told you.
Yeah, because, I mean, like, it got, like, she already came in with gangrene already. And we're, like, telling her, like, hey, you need to take the medication. You need to make sure that you're cleaning yourself. Like, it's basic. And it's just basic hygiene. It's not even anything scary. You just literally have to wash your hands before you clean it. Clean the wound with soap and water. Make sure it's dry, and then just put in what we already gave you, like, what to put. So it's not that big of a deal.
It doesn't sound like that big of a deal, and that raises the question: what are some of the most avoidable things you see frequently that people come in for, or that you saw? Because I know you're in different line of work.
Let's see. Most avoidable. I definitely want to say diabetes and high blood pressure are very avoidable. I mean, it really is a lot of food intake. When you have things against you, like when it, like, for example, hereditary, like diabetes, it's a little bit more difficult. Not unstoppable, because you can, but if you choose not to, it's gonna come back and whatever. For example, like my stepdad, he was getting high cholesterol. Because, I ran his test, and, he was coming back with high cholesterol, and I told him what to eat differently, did his blood work 3 months later, and all his labs were perfectly normal.
Well, there you go.
And it's just, again, no medication, no nothing, just told him how to eat better, do a little bit more yard work at his house, and 3 months later, he was better. So it's just awesome. Literally things that you could just avoid: high cholesterol and, like, diabetes and high blood pressure and, like, stuff like that. Other things, it's not possible. I mean, you can't control a heart attack. I mean, you could. I mean, if you eat like shit, you could.
Hereditary, ongoing, like, heart issues.
Yes,
that's
yes.
hard to
If it's something like that, no, it's something you cannot
So mostly it comes down to you can control what you eat.
Yeah.
What you eat has a lot to do with your health.
Absolutely. It
Yeah.
does have a lot to do with your health.
But people
Absolutely.
eat like shit in this country.
They do eat like shit in this
They
country,
eat what they want
unfortunately.
when they want. They eat large amounts, and then they wonder why they're so
Yes.
unhealthy.
Yes.
Yeah,
Yes.
obesity, I think, is still the biggest epidemic in our country as far as bad
Yes.
health, unless I'm wrong.
Obesity was right now. I feel like it's not, and only because
Opioids, right?
yes,
We have opioids.
Opioids is right now. Opioids right now.
Opioids and obesity, still
Yes.
probably 1 and 2.
And it leads to the same things: diabetes, high blood pressure, like cholesterol. It literally does. Like it's just like a little circle. It's just it's kind of annoying because it's like you can definitely treat it, yet you still eat delicious greasy food. And don't get me wrong, I love delicious greasy food. However, I try to eat it as little as possible. But there is a lot of things that you can do to make sure you don't get to that point.
I would say if you stayed away from like fucking bread, you'd probably be.
Okay, first of all, I love bread. Bread, I love you. I could eat bread all day, every day. I'm like, I love bread. Like, you don't even know. I could put bread like on cheese. Okay, if we're gonna talk about bread, this is gonna take a whole other episode.
Let's pause on bread.
Let's
pause
digress.
on bread. I want other things I want to ask you. All right, so let's talk about something that is relatively new in the medical field as far as it's okay.
Okay.
Legal marijuana.
Yes.
So it's still very new.
Yes.
I'm sure 25 years from now we'll have a whole different outlook on it as far
Absolutely.
as what it does to people, how much it does, what it does to people. Has it changed the way you've done nursing, even in where you're at now?
Yeah,
like
actually,
working
yeah.
with
Well,
cancer and stuff?
one of my patients actually, I was doing infusion. She was getting infusion done in the next room, and the nurse that was treating her or was doing the infusion came to speak to my doctor and said, hey, the patient needs to get this. However, she's not able to give consent because she's really high right now. And the doctor, he just started
never even
laughing,
thought of that.
and then he's like, "She's what now?" She's like, "She's really high." She's like, "She's extremely high." And I didn't see my patient because she was on the other room, so on the other side of the facility. So I'm like, nah, I'm not gonna walk that right now. So I didn't get to see her, and the doctor's like, "It's fine, as long as she's if her daughter's okay to give the consent, we can treat her for what she's here for." And then the next day she came in and I met who she was. And it was this cute little 82-year-old lady. And like, I swear to God, she weighs like 80 pounds. She's the cutest thing on the planet. And she was like so stoned. I was like, oh my God, I'm dying with her. I can't. But to be honest, maybe about, I want to say maybe about 40% of my patients in oncology do medical marijuana. They do either smoke it, they do CBD oils, they do like, they do a lot. They do a lot with the medical marijuana, and thankfully my doctors have been very I don't want to say inviting, but very encouraging that if it's something that is helping them, they do want them to continue. They don't weigh in like, oh, it's bad for you or anything like that. They if it's something that's helping the patient, and honestly, to be honest, as a person who does smoke marijuana, I can say that it does help me because. Obviously, I've had patients, who have died on me, and unfortunately, like I've gone through that, and it does help you kind of relax a little bit, and it does kind of help you with anxiety. So, I mean, unfortunately, if you're looking for an answer to say no, don't do it, you're not going to get it.
Well, no, I'm just curious as to what your take on it is.
Yes, honestly, and then I do see cancer is very painful, and I have seen it firsthand. My Nino had cancer, and I'm not going to talk about that because I'm not gonna. But I have a patient right now who has lung cancer, and it sucks because we're actually the same age. And she smoked for 2 years. 2 years. She didn't smoke before. She didn't smoke after. She stopped. She quit maybe like 4 years ago. She only smoked for 2 years, and she came back and she has lung cancer, and her lung cancer already spread to her bones and her bones on her ribs. And she was at my office, and she was just in pain on her ribs. And like, I mean, the pain was so severe, she literally just cried out of nowhere, and she just couldn't move. She was just like there. She couldn't move. She couldn't like breathe because it was just like every breath was painful. And it sucks because you want to tell them like, hey, like you want to help them, you can't help them. Yeah. You can't as much as you want to, and whatever. It's for that particular patient was impossible for me to do anything for her. But it sucks. But for me, I like, she was like, it's fine. She's like, I'm going to go smoke some weed. I was like, you know what? And I did encourage her. I'm not gonna lie. I told her, you know what, you go ahead and you just go do that, and you just, enjoy yourself. I'm really sorry, that you're having the pain, and I helped her out to her car, and that was pretty much it. But I will say that I do encourage my patients, if they're already smoking it. That's not something that I push to them or anything like that. If they bring it up to me, I tell them, like, hey, you know what? If it's helping you, why not? That's usually my response to it. But I do not encourage it. I do not promote it. I don't do any of that.
Are there any possible dangers of it in the sense of long-term use affecting somebody's dopamine? Have you seen anything like that? I
have not seen anything like that. I cannot put my weight on that because I really wouldn't know how to answer that.
Do you think people get physically addicted to it?
As someone who has smoked for a very long time, I'm okay without it. Like, let's say if I go for months, which I have, without it, it's not a difference for me okay. At least. So as someone who has smoked it for a while, I mean, I can't say it.
Yeah, I don't smoke at all, so I'm just curious to see how the legalization of it has affected your guys' line of work.
As far as line of work, I do see a lot of patients that actually do smoke a lot of more medical marijuana. I do.
Well, we already talked about like how it helps them with pain and stuff.
Yes.
And with people where you work now, I do see the benefits of it. I personally think there's a lot of placebo effect to it, especially for people who don't have serious chronic illnesses.
Yes.
But it's legal, so who gives a fuck, I guess.
Yeah.
Again, 25 years from now, we'll probably know a lot more.
Oh, absolutely.
So let's talk about something else now. Your line of work, you would definitely think would be very apolitical. But everything under the fucking sun, including the sun itself, has been politicized.
Yes.
Which is why you're anonymous today on this show.
Absolutely.
How the fuck do you deal with things like that? For example, like the really, really big politicized topics, abortions. Let's start with abortions.
Okay.
Roe versus Wade keeps it legal. There's a lot of talk right now about getting rid of it entirely. And then there are people pushing on the other side where it's like, no, you can even abort a live baby, both of which seem to be on the extreme ends.
Yes.
How do you, as a medical professional, keep things apolitical when things have gotten so political to the point where the president or the CEO of Planned Parenthood was fired for having an unpopular opinion about gender, which is something else I want to get into in a minute.
Yes.
Abortions, how do you stay middle of the road with things being so fucking heated right now?
I did work previously at this is where having 11 years it's a great great
this is why we're talking.
Yes. So I was fortunate and misfortunate enough to work at a place where they did abortions. So I did have a little bit of experience on that. I don't want to say that I support it, and I also don't want to say that I do not support it. I'm very neutral with it, and only because I have been on both ends of abortion. And what I mean by that is that I've seen patients who use abortion as birth control, who is absolutely terrible. Like, I mean, there's literally, your body goes through a lot with that already, and having to use that as birth control 5, 6, more than 10 times it's
more than 10?
Yeah, more than 10. Yeah. I've had one who's had 12. So
fuck.
Yeah. So and at the end of where I worked, where that happened, she did ended up having one baby, and like she just had a really brutal pregnancy. The baby was fine. It's just for her, it was really brutal. And again, your body goes through a lot. But again, there are instances like, I mean, again, like how, I said, like any rape victims that get pregnant by that obviously don't want to have a reminder. So absolutely, yes, get an abortion. Absolutely. Like, no, there's no question about it. And again, there's stupid people who use that shit as birth control. No, like you should literally like not be able to do it. And only because you should not be using this as birth control. There's literally birth controls out there. You could use it. Yeah. This is not a form of it. There's some people who do use it, and they take way too much advantage because, again, who's paying for it? If you go to Planned Parenthood, I know from experience, not that I worked at Planned Parenthood because I did not, but what I mean is that we've sent patients to Planned Parenthood. They charge you, at that point, they were charging you $55, and you have to just show proof that you were pregnant, and you paid your $55, get your abortion, and you're on your way.
That was it.
And that's it. But it's like, it's they make it easy, yes, because it's, again, if you can get rid of it for $55, why not get rid of it?
Yeah.
If it's something that you don't want to have, if it's something you don't want to have, exactly. If you don't, another thing that people have to remember, this takes a big psychological toll on the person, depending. Maybe for my person who had the 12 abortions, maybe for her it was just like,
I would imagine it was just
it's
another day.
It's another day. Like I'm sure, but for people who really struggle with having to do that, it's something that you'd never ever get over with.
So, because it's so politicized, there are waves of people who understand very little to nothing about abortions, how they work.
Yes.
The things you just explained, for example, they probably don't even have fucking knowledge of or don't have any conception of it.
No.
Your point of view on it is pretty much matched with mine. Like, it's here. It's you shouldn't use it as birth control, but there are going to be instances where
there's certain instances absolutely that it definitely should be used, and I'm all for that, but I am not all for using it as birth control, because there's literally things that you can use it. You're just choosing just to be like.
And so where does a hospital fall into all this? If a hospital has a policy that, because certain hospitals have policies where they go, we're not going to do this.
Yes.
And they're taking a lot of heat because there are people, again, who are uneducated, and they don't give a fuck about the medical aspect of it, the psychological aspect of it. They just want abortions here, all the way and up to killing a baby after it's been born. And then you have the other side who never want them because of God or life or anything like that.
Yeah.
And
there
how
are
does
hospitals that do that.
Yeah, there are. But the religious ones, like the Catholic based ones.
Yes.
But how does a hospital in the middle of all that say, listen, this is what the medical information is. This is what we can do. This is what we can't do. This is what we should do. This is what we shouldn't do. How do you guys maneuver through all that bullshit?
So as far as performing any abortions at hospitals, I have never done that at a hospital, and I don't think any hospitals do that.
I've never heard of one, no.
So they don't do that. However, I know that the religious hospitals, my friend wanted to have her baby at a religious hospital, I won't say which one, and she was denied because she had an abortion before. It was a circumstantial abortion, but it really should not matter because, you're there, you're having a baby, and you're having a baby. You should not be in the middle of the fucking street to have a baby.
Right.
And she was denied to have services at the hospital because she had a previous abortion, and it sucked because the other hospital was like way the fuck down Egypt, so it was quite horrific for her. She almost had her baby in the ambulance because they had to like transport her to another hospital. So it sucks in that point where, whether or not you had something that you're obviously not, agreeing with, does not mean that you have to deny services to anybody. And especially if it really is about, the abortion, there is a baby who's about to be born and you're denying the services to that baby.
Right.
So is it really because it's unethical or what really is the problem?
Are you just taking a stance on it for the fuck of it?
Yeah.
And that's the hard part.
Yeah, it sucked, and it sucks that they still continue to do that because, again, a hospital is there to be treating anybody. It really doesn't matter. That's what you're there for. And when you start, picking and choosing, are you even really a hospital, or are you or at all a busy hospital? Because nowadays, come on now. Yeah.
Are there certain extremes, though, that you think a hospital should be able to say no to, like this post-birth abortion stuff that was going on?
Oh, absolutely. That's a big
year?
No. That's a gigantic no. And that's a no because, again, I'm a mom. And, the thought of hurting a child after they're born, no, I'm sorry.
Well, no. What was it in, because Virginia passed a law and New York passed a law, Colorado. I think California has had this law for a while and no one really talked about it, where if the mother 8 months, 9 months, or is about to give birth, and she decides she doesn't want the baby. I think the laws on hand talk about failed abortions where the baby survives and is still alive, and then they decide what to do with it. But by the time it fails, the baby's already out. It means the baby's technically born.
Yeah.
Like in Virginia, in California, in Colorado, in New York, somebody can make a decision that that's still not a baby. Like, is that an extreme that you just don't see hospitals going far with?
Oh, no.
No. Like, I know a doctor is, like, supposed to help a patient. I know a nurse is supposed to help a patient. Yes. And I know we all kind of have the general consensus, unless you're extremely conservative, that the mother's health is
Yes.
first and foremost. But like,
Yes, absolutely.
can you guys get in trouble for drawing that line, or is it just not come up enough yet? We just don't know.
I don't think it has come up enough yet. And honestly, I think if I were to work at a hospital that did that, I do not think that I would work for that hospital.
Right.
And only because that's already murder. I'm sorry. There's no such thing as like, there's literally other resources that can be done. If you really don't want to have that baby, there literally is thousands of other things that you can do that does not require you to kill that child.
But looking at it from a medical procedure, I mean, it is something that we do. It is something that...
It is unfortunately something that we do. And again, this is firsthand because I have seen it. I haven't seen the most that I have seen would be a second trimester. I have not ever seen a third trimester abortion, and I really, really glad I have never had, because I've already seen the second one, and it is quite horrific. Let me just tell you that. It is one of the most... That is the most horrific thing I think I have ever seen. And let me tell you, when I was little, I saw like a whole bunch of dead bodies coming from like the ocean when I was in... This trumps that by miles.
Yeah, I think this is just the stuff people don't... I think it's just become a political talking point. So the details in it don't really matter as much. Yeah, no,
that is quite terrible. And no. And anything past that, honestly, it's anything but it's murder. It's nothing else. And only because it's the baby's already fully developed.
Right.
It's like already has lung capacity. It already has like everything. It's already formed. It's just waiting for like the time to be pushed. And it's terrible. And if you like, again, I worked in OBGYN for a long time, and I've had patients who, one of them unfortunately had a fetal demise the day before her actual due date.
Yeah.
And it sucked because, I mean, she lost her baby. Like, I mean,
right.
You know, it's horrific. It's terrible.
Well, I think that's what's fucked up about it is that there's a whole lot of medical information regarding abortions and the procedure and how far along the baby is and all this that people just flat out ignore.
They do.
And it doesn't seem like it's made your guys' job too difficult yet, but it's being pushed so hard in such far contrasting directions. It's like, fuck, man, how do you combat that?
For example, I know Planned Parenthood, one of their employees is one of my friends, so I know where she was working in particular because it's in LA County. Obviously, in LA County, everything is obviously over the top.
Yeah.
And I'm from LA, so I know because, I mean, I'm over the top also. But I mean, either way, you know, when she works at Planned Parenthood, the days that she works there, she needs to go in with normal clothes. She's not allowed to go in with scrubs, and she's not allowed to come out with scrubs. They have to go in with normal clothes and have to come out with normal clothes because of the fact that there's protesters that can like hurt them or, you know, do any of that. And it sucks that you have to go in a different way to work because you're like, you know, you could be stabbed or like, you know, hit by somebody who's protesting what you're there for. And again, it's not something that when you start going to school for, hey, I'm going to go into an abortion clinic. That's not something you choose to do. I don't think I have ever heard anybody say that they're going to school because they want to work in an abortion clinic, like ever.
It's just something that
it just happens. That, you know, that you get a job there and, you know, it's a good job. You know, working at Planned Parenthood, it's a really good job. Planned Parenthood's a really good job. But then again, it also comes with its terrible attachments. And unfortunately, one of them is to be fearful to have to work there because you can get, you know, attacked. And again, not all Planned Parenthoods are abortion clinics. They have specific clinics where they do that. So, you know, they unfortunately track them down, and it's easy for them to be kind of like prey because it's, you know, and again, this is not something that I'm here to do. Like this, it just happened to be my job, but it's not something that I went to school for. It's not something that I wanted to plan to go do. It's just, you know, what it is. And honestly, the ones who kind of suffer most are the doctors. The doctors have to be the one who do that. Some of them, I mean, there are some that are just, you know, careless and they kind of just see it as a day-to-day thing. Yeah. And there are some that honestly really do take it very, very, not personal, but it's very painful for them. And you can see that. You can see that after the fact, not during, because obviously you're in procedure and you kind of have to be more professional about it. But once you get out of the room, us as nurses and them as doctors, we confide in each other and we definitely talk not about the patients or patient care or anything like that, about that, but how you're feeling emotionally after. Because there are some patients who just mentally drain you because you want to help them, and no matter how much you try, you're just not going to be able to do it. And that is what actually gives you that mentality. Not that you didn't do anything to help them, it's just you can't do anything for them at that point. And
see.
that's what's painful.
Well, like it or not, it's legal, and I think people should really let you guys do your job and tell the truth about it and accept it, because like every other thing that's considered either a vice or a service that we're so used to, whether it be alcohol, tobacco, whatever, they're not going anywhere.
Absolutely not.
So you can either do it right and listen to these medical professionals, or you can let the crazies get a hold of it and have shit get fucked up, or you can cut it off at the knees and have people do it underground.
Yeah.
So.
And you know what? Let me tell you that there is one doctor that I listened to a podcast for at one of my favorite podcasters, besides my best friend right here, would be Sword and Scale, where I did hear, I forgot the name of the doctor, and it's definitely not in California, where he was doing abortions. Pretty much, he would have 2 floors. The bottom floor was, he would do abortions where people, pretty much minorities that were either black or did not have any money, would be able to get abortions pretty much for free. But it came with a cost. The medical supplies was not sterile. Nothing was clean. There was blood still on the floor from the previous patients. Nothing was clean.
What the fuck?
And there would be a lot of women who would come back with infections, obviously, because nothing was cleaned. A couple of them died because of the infections. And in the end, you ended up finding out that he would keep the baby feet in jars. So just imagine that.
That's fucking bizarre, man.
Yeah. And these were trimester, third trimester, second trimester pregnancies. And
this was like underground?
This was underground.
Yeah, see. So that's what you get if you make it illegal. So it's legal.
Yeah, absolutely.
I think we should work around it. Now let's talk about something that's not legal, but maybe should be. I've never actually got an opportunity to ask a nurse this. Euthanasia.
Oh, well, there actually is one state right now. Oh, fuck, where is it? Can't remember. But it's called it's like a mercy something.
Yeah.
I can't remember. But yeah, there is one state that's allowing that to happen.
What's your
where
medical...
the doctor, honestly, for me, and this is just my personal opinion. I'm sure other nurses are going to have their own personal opinion. For me, if it's somebody who is extremely sick and honestly just doesn't want to go through with that, yeah, absolutely. If the patient has the option to do that for themselves without having to do all the suffering, I mean, it depends also. Like, let's say if you are stage 4, I mean, you're metastatic, you know, you're good. Like, you already know there's just no treatment. Why not? Like, why do you want to have to go through the pain and suffering of having to go through chemo, having to go through injections, having to go through all that if you absolutely know that? And you know what? I'm going to tell you, honestly, I the doctors that I work with right now will tell you how it is. Hey, you know what? I feel like this will be working for you. You know, I did have one case where my doctor's like, you know what? I just don't see how anything that I do for you is going to be able to help you. And, you know, just kind of like live it out at this point in time. And at this point in time, she is living it out. And you know, if she would choose to do that, I would be like, yeah, you know, why go through the pain? And it sucks. And I'm going to search up where that
yeah,
they do
please
that,
do.
'cause I can't remember exactly where it is. And you have to be actually licensed to do that. Like, it's not any doctor. There's specific doctors that are licensed to do that kind of
It's bizarre to me that the government or the state or whoever the fuck would tell somebody what they can and can't do with their own life if they so choose to take it, especially for medical reasons of like pain and suffering.
Yeah, I know. You know, like my uncle, like when he had he was going through his cancer, he was in a lot of pain, and towards the end, I mean, you know, if you've ever, you know, seen anybody who's been at that end, I mean, they don't even remember you. Like, he didn't remember us. You know, he was already at that end, and he used to look like Richie Valens.
Yeah,
like he looked exactly like him. And at the end, it's like we couldn't even recognize who he was. He like lost like a lot of weight. He was like skin and bones.
And see, there's a lot of people who don't want to go through that. There's a lot of people who don't want to go through 8 months or 6 months or however long it is. And they don't want the last memory that their loved ones have of them to be this decrepit person that you can't recognize anymore because their hair's gone and they've lost all this weight. And so a lot of people just commit suicide on their own.
Yeah. And I feel like that's like the worst way because, I mean,
because somebody has to find you.
Yeah, exactly. One has to find you. Like, actually, that happened to one of my coworkers that I used to work before. I think she found her husband.
Her husband?
He was like hanging like in the garage. So it's just it's really, it takes a toll. It really really does. It sucks, but I feel like if you had a different way of doing it, more professionally, more medically, and they put you to sleep and you just don't wake up. I would rather do that than having like a shot through my head or like, you know, I would rather be like, let me just go to sleep and never wake up. And that's exactly how I feel like I'm going to die, hopefully. Like that's what I'm hoping for my life. Like that's literally what I'm hoping for. Not drowning and definitely no fire.
Yeah, fuck all that. I've almost drowned. It hurts.
Oh my God.
It
You know what?
fucking
My
hurts.
boyfriend did too. And he said the same thing too. Oh, you guys are
Like
sad.
right here in your
Yes.
chest, it's painful.
No.
And then you get dizzy, and then it's
hell
weird.
no.
I've almost
Stop it.
drowned. It's not fun.
No.
Okay, so let's go back to the politics in your job.
Yes.
It's starting to die down a little now. I imagine with the 2020 election around the corner, it's going to pick up again. As with everything, I think everything's going to fucking spike again. But the multiple genders, the transsexual movement,
Yes.
and I'm not talking about necessarily the transgender individuals themselves.
Yes.
I think the individuals themselves, for the most part, understand they understand their biology and how they need to be treated. But there's a lot of talk now about, you know, treating people for whichever gender they want to identify as, and all this is that. And organizations, as we've called places where you work, their self-interest is always in making sure that conflicts do not arise.
Yes.
Which is why people usually cave in to the demands of the few, so they don't have to hear about the noise. How do you go about, as a medical professional, transgenders, or at least the transgender movement that doesn't want to accept the fact that there are two genders? Because let's be real, there are only two.
Yes. The organization that I work at now is extremely super gender equality. So we're really heavy on LGBTQ. Okay. We're extremely heavy on it. And as a person who is bisexual and who has a lot of gay and lesbian friends, I am all for all of that. I love all. Actually, I think I love like gay, lesbian, you know, bisexual, transgender. I think I love them more because they're just more, not interesting, but they're just more, I don't know, more open about everything.
Okay.
However, there are transgender people who I feel that they're more entitled to than they really are. For example, when I used to work at county, I had a transgender male that was turning into female who wanted to have a pap smear. And I know this is gonna sound crazy, and believe you me, I know. And we told the patient, we will do the pap smear. It's not about not doing it. And I'm like, but just to let you know, the insurance will not cover this. Why not? And the doctor told her, you are considered to be a female, yes. However, you have no cervix, you have no uterus.
There's nothing to pap smear.
There's nothing to smear. So the insurance will see it as a non-covered. You will be responsible for the full cost.
It would basically be a cosmetic thing.
Yes.
Right? Yeah.
The full cost is $150. It's not expensive. But she was really upset because she's like, you know, you need to do it. And again, we will do it. We have no issues with doing it. There's no problem with us doing it. The problem is the insurance is not gonna pay for it. You will be responsible. We just need you to make sure you understand that you will be responsible to pay for that particular test.
Do you think it's necessarily healthy to do something like that with somebody who doesn't need it? Like, do you think you're encouraging
the behaviors?
I don't want to say behavior, because I do think there are people out there who do have gender dysphoria and things like that. I don't think those people are asking for pap smears when they know they don't need one.
Yes.
The transgender people I know are fully well aware of what they actually have.
Yes.
And I would never imagine any of the people I've met who have that particular condition walking into a doctor's office saying, hey, treat me for lady parts I don't have.
Yeah. Yes. There are people who are like that, because I have worked with quite a few transgender patients.
Well, what I'm talking about is the people who go in there, like that guy up in Canada who was trying to get women to wax, quote unquote, her genitals, and they all said no because you have a dick. Yeah. And not only do I not feel comfortable waxing someone with a dick, but it's a totally different technique than giving a Brazilian, like a manzillion is different than a Brazilian.
Absolutely.
And this guy just went on and on and on about like, oh, I'm being discriminated against. No. Like he even wrote emails to these waxers talking about, I'm on my period. Will that make a difference. And it's
That
just
is
like, that
horrific.
is
It's
just not true.
Yeah.
That is not true. So do you think it's healthy for a hospital to sit there just from a medical standpoint, not your own personal view necessarily, but like from a medical standpoint, to encourage that kind of behavior?
I don't think that it's a good idea to do that, because now you are going to be putting that idea into their mind that they can be seen for anything that's female related.
Because it's just medically not true.
Yes, it's just not medically not true. And I would be really surprised if the insurances will pay for female with insurances, for example. They ask you, like, are you male or female? And then even now, even more now, were you born a female or a male? It's not like, are you a male or female? No, because you could just I could put that I'm a male. But now the question is, were you born, or were you given, female or male parts? I don't know exactly the how they're asking it, but the insurances are asking you, were you born male or female? If you're born male and they see that you have a charge in your insurance for a pregnancy test, they're not going to cover it, and you're going to get stuck with that.
I don't think they should cover it. I think...
because it's not something that... It's not medically necessary. That's the thing. It's not medically necessary. So the insurances will not cover something that's not medically necessary.
What do you tell a person, though, who is going off on that tangent? Again, I don't think actual people with gender dysphoria are doing this. I think it's people who might have some other kind of psychological thing, or who might be looking for attention. I mean, this is a different show about, our generation and the whole attention-seeking thing. But what do you do to a man who claims to be a woman, who walks in asking for female services? What do you tell them? Have you run into that?
I did. That one patient, the one that I told you,
but you said you would do it.
Yeah, we said we would do it.
now?
So for let me tell you, for me, I have worked with quite a few transgender people, and actually none of them have ever said, like, hey, can you treat me to see if I have a
That's
hernia?
what I'm saying.
Like,
that's what I'm saying. I don't
I've
think
never
anyone
really
who really
across.
has it.
I think, I only came across this particular one. And then I'm not really sure if she was trying to just seek attention, or I'm not really sure, because she did come with her partner, that she was with, and he was like kind of also not questioning, but he was definitely looking around to see, like, why would you want something that's not for you, not, you know what I mean? But for us, since at that particular doctor that I was working with at that time, she was very open about doing it, so she was okay with doing it. However, the organization that I work for also is very, 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 very heavily supported about LGBTQ. So for us, we would also provide that kind of service.
Well, I think you could be supportive without slapping 1,000 years of medical research and knowledge in the face.
Yes.
Do you fear that continued trend of satiating that mindset will lead to any type of disruption in your line of work?
Absolutely. It definitely.
So again, it becomes one of those things like abortion, where you draw the line to where it affects your professional.
Yeah, absolutely. And I don't want to say that it's a waste of time for us to do any of the tests for the patient, because no, if the patient is really here for something, we're going to treat it. However, I feel that it is unfair for you to come with, just because you want to come and just see how much of a woman we will treat you because you're a woman. And it's not like, for me, I'm not going to be like, oh, you're not a woman, or I'm not going to do this because you're not, you don't technically have all those parts. No, I'm not going to do that. However, I do feel that you are kind of wasting medical resources on somebody who could actually use those kind of resources to do something that it's not going to come to what you
That's
want
why
it
I
to be.
think y'all should personally say no.
Honestly,
I
like,
think
if
you
it's
should.
something that I could say no to, depending on the person, I think not the person or the reason. I'm sorry, the reason, not the person. If it's something like, hey, I want to get pregnancy tests, what do you think is going to happen? Or you're going to come out negative. You know that, right? Like, I just need you to understand you're going to come back negative. Unless you have, like, some kind of, like, testicular cancer, that could come up positive in your pregnancy test. It's just like, you understand the risk that you're taking, right? I'm not saying that all pregnancy tests are going to come out positive. Right. I'm just saying. It's just like, no, I'm not going to do that. However, it's not my call. Since I work for an organization, you as a nurse, you give up your, I don't want to say your rights, but you give up a lot of your things because the organization is.
Well, like any other job, you do what the company wants you to do.
Yeah, absolutely.
I understand
absolutely.
that. So when we're talking about transgenders. We're talking about males and females, but we're still talking males and females. Have you come across any of the agender, gender neutral, gender queer, gender fluid, the 60,000 different genders? Like, how do you go about that person if you've run into them, or if you know someone who's run into them?
I have run into a couple. Thankfully, the ones that I have come across have been very like, whatever. I think one of them, she did make me laugh. She was, she put like, I guess.
Oh, you said she. Be careful.
Okay, no. She was a she. She was. She put on the paper. It says, "What is your what question?" I can't remember the question. She's like, "Oh no, what's your gender?" She said, "I'm a human." And I was like, okay. It made me laugh because I was like, yeah, you are a human. That's not what I'm asking if you're a human. But
yeah, we didn't ask your species.
Yeah, we didn't ask your species. I was just laughing when I read that. I was like, oh my God, she's a human. And then I remember I greeted her. I'm like, hello, fellow human. And she just was not amused. And I'm like, I'm trying to not make fun of you. I think it was witty of you to say they were human. Like, you know what I mean?
But the thing they need to understand is this is how you are going to treat them.
Yeah.
This is how you know how to treat certain things. Because if a man comes in with having chest pains like a heart attack, you deal with it a little different than a woman. You look out for certain different things because to my knowledge, the woman's arm doesn't go numb. I think it's like back pain or some shit. Yeah. So
it's very different.
You have to know in order to treat them. And if they start pulling this shit of like, oh, I'm not either, so if you treat me like a female, I'm going to get all mad, which I don't think has happened.
No, I've never heard any of that. Like,
but do you worry that it might? Just, I personally don't think it's going to get to that point because I think when it comes to life and death, people are going to cut the bullshit.
Oh,
and be
absolutely.
Like, okay, I'm a girl.
I just need you to treat me. I need to make sure I'm alive. Like, that's it.
So you don't, because I don't think so, but you don't have that fear either.
No, I don't have that fear. No, I don't. I don't because, I haven't come across that, and I don't think that I ever will. And only because at my point of my job, I mean, let's cut the bullshit. You're just here because you want to get better, and you don't. And if you don't tell me what your human anatomy is, we won't treat you the way that you're supposed to be treated.
And you're gonna get sick, and you're gonna die.
Yeah, exactly.
And I like I said, I don't think that it's going to be widespread. But you look at the CEO of Planned Parenthood recently, who was fired for saying men can't get pregnant.
It's just not possible. It's just not possible.
But she was fired for saying that. So it's like, okay, we're sitting here saying in this conversation, we don't think it's going to get to that point. But then you look at that situation, it kind of already has gotten to that point. So
next thing I want to hear, like, it's like saying, if a man goes to in vitro, you're not going to get pregnant. You have no uterus. Where is the baby?
No, but now that you can get fired for saying that.
That's what I'm saying. It's like you absolutely. First of all, that's just ridiculous when I read that. Because
how do you combat that medically?
How do you combat medically? I mean, unfortunately for her, she's not able to combat that. Like, no matter how much she tries, it's just not going to be able to be science. Like, I mean, science is the only way to prove her right, which is terrible because it's like it shouldn't be up to science. It really should be how it is. Yeah. A male, B, a female. Whether you're, male being a female being a male, it doesn't matter. Guess the fuck what. It's one of you can't get pregnant, the other one cannot. It's just no matter what. Whether you have a dick and you had a pussy before, it doesn't matter. You don't have a uterus. You don't have the eggs. You don't have anything for that.
For your sake, I really hope it doesn't go past that because then it's just going to become impossible to treat people.
Yeah, honestly.
It's like, well, listen, I got to treat this person as a male because they're male. Well, no, they identify as this, so you better treat them like that. Okay, well, now they're going to fucking die. That's the worry, but like you said, when push comes to shove, I don't think people are gonna disallow you to treat them as a male if they claim to be something. No. So hopefully you guys don't come under that kind of pressure the way the Planned Parenthood CEO.
I know that was quite horrific when I read that. I was like, it's just not it. I'm like, that's not offensive. It's the absolute fucking truth. I mean, again, this goes back to just being an actual human. It's just not fucking possible. It's just not. It's like, okay, like it's just saying like a doll can also get pregnant because obviously it's a female, so it can get pregnant. It can't. It's just physically not possible.
No, it's not. Okay, so there's another thing I want your opinion on. I have you here. I'm asking you all the fucking questions. Anti-vaxxers. It's a movement. It's picked up steam. I saw a thing on Facebook recently where, do you know that Facebook page called God?
No.
Okay, there's a
I'm gonna be honest. I go on Facebook like very rarely. I only go there to talk to my dad.
Okay, there's a Facebook page called God, and it's kind of like the person who posts like witty, ironic things from God's perspective, in which you laugh because it's like, oh hey, yeah, that's dumb. And the most recent one that I saw was talking about the anti-vaxxers, where the person posting it was comparing because public schools are now telling parents who don't vaccinate their kids to homeschool their kids. Like they can't come to public school.
Absolutely, and I think that is correct.
So this God post was comparing that to segregation.
Okay.
Back in the 50s and 60s.
No.
But that's what people are kind of getting to is like, hey, if I don't vaccinate my kids, you should have to deal with it. Medical professional opinion, anti-vaccination. What is your take?
No. Let me tell you, I am definitely not an anti-vaxxer because I've vaccinated my son since he was born.
Right.
And I've actually been the one who has given him his shot since he was born. So I know, well, not the first one because I was obviously not able to. But the other ones, yes.
Yeah.
So, yeah, no. The only one that I do not give my son, and that's my personal reason, it would be the flu vaccine.
Yeah, I don't do that shit.
I don't do the flu vaccine. Myself personally, I don't do it. This year was the first year that I did it because I was practically coerced by one of my freaking like nurses. I won't mention her name, but she definitely knows who she is. So I've always been the one who wears the mask because I personally just don't like it. And I don't like it personally because I had it once and I had the worst reaction ever in my life. And I'm like, nope, I literally passed out like maybe about the next day when I was at work. And because I just couldn't, my body was just not able to handle it.
Well, don't they give you the flu when they give you the flu shot? So your body can like learn what it is and fight it? Yeah,
and let me tell you, I got it that 1 year, and I never got it since. Not once have I ever gotten the flu, and not once has my son ever gotten the flu. Because I expose him to what I have at work, and he exposes me to what he has at school.
Right.
So we kind of counteract each other. But no, my son is definitely vaccinated, and the only one that I do not give is the flu vaccine, and that's only for my personal perspective. When he's older and he's able to make his own decisions, he can decide to do that on his own.
Yeah, I won't do the flu vaccine either. I've never had a flu shot. I've never had the flu, and so there you go.
You're good. But for me, anti-vaxxers, honestly,
but we're not talking about flu shots, are we? We're talking about polio, measles, hepatitis A and B.
I feel that's no, definitely get them because I mean, for people who you're exposing to, that's not fair for them because they should not be exposed to something that they are being like, not cured for because you're not cured for it, but you're being protected against, and you could possibly have it, and now you're exposing them to that, particular thing. It's not fair.
Well, the anti-vaxxers thing, I mean, I don't really know what their thing is. I haven't read a whole lot into it because I think it's absolutely fucking ridiculous. Modern medicine exists for a reason. Look, there's a lot. We were talking about pill addictions and all these things that are terrible, but for the love of God, we've gotten rid of polio and all sorts of fucking things that were killing people in droves not even 100 years ago.
No.
In droves. And we're talking hundreds of thousands of people. And now with a little shot, that can go away.
Yeah. Yeah, for example, for the measles outbreak that just happened, I had one of my patients was one of the people that was in the theater at downtown Fullerton that was exposed to it. And again, we treated her. So that means that we also are in the same vicinity, which means that we can also be carrying it.
Right.
And who do we come home to?
Your kids.
You come home to your families, your kids.
And that's where I don't understand the anti-vaxxers thing. Like, we want our kid to be natural and healthy. It's like, okay, well, you do understand that planet Earth designs things to kill species for population control. We have figured out a way around it for now. And by not doing so, you're going to expose your kids to very sudden and almost certain death. Yeah.
It's like, for example, like for the HPV vaccines, before it was not really for males. They were not like encouraging boys to get it or males to get it.
Right.
Like, they were just not. And then recently they started doing it for male and female. And my son, better believe, he got the first shot already because I'm like, I'm not about that fucking life where he's not going to be like not protected. And again, because HPV can definitely, progress.
Men usually are the ones who transmit it. Men are
typically the ones to begin with.
So you don't consider it discriminatory at all when
Absolutely
people say,
not,
"Hey, you keep your kids at home if you're not."
Hell no. I would be like, no, and not because you're protecting my son, because my son's already protected.
Right.
It's to protect your son.
Right.
Because for people like us, like nurses that have kids go to school. So when I come home, like I take off my scrubs, but like the first thing my son does is when I come home, he hugs me.
Yeah.
That's the first thing. It's like as soon as I come home, he hugs me. So whatever I have on my scrubs goes onto my son. Obviously, he takes care of himself. He washes himself and all that stuff. But hey, it's already something in his body and his lungs. So when he goes to school the next day, he exposes everybody.
And as a hospital, because you do have to treat everyone, if these parents finally break down because their kid's dying of some sort of fucked up illness that could have been prevented, you bring them into the hospital. Do you guys have to quarantine? Do you have to do?
Oh, absolutely. There's certain infections that yes, you do have to quarantine. Like no matter what, you have to quarantine.
And do you? Well, this is a callous ass fucking question, but just out of curiosity, is there, to your knowledge, any kind of backlash from the medical community going, we shouldn't have to expose all our people to your nonsense. So if you don't vaccinate your kid, maybe we shouldn't be obligated to treat you.
We do, however, it's more internal.
Right. It's like an internal opinion. Yeah.
It's an internal opinion. I cannot speak for all the nurses.
Sure.
It's really more internal. It's not something that we like broadcast, but obviously it's like, dude, don't be fucking dumb. Like, come on now.
Yeah.
I get it. You don't want to vaccinate your children, and that's fine. But don't think that you're going to be like that your child deserves to be in the same school as my son or as, other kids that are being protected, and you could probably have it, and now you're exposing my kid. Yeah,
I have total sympathy for the child who doesn't get to make that decision, but I have no sympathy for the parent.
I have no sympathy.
I won't say who or what, but someone I know has a friend who doesn't vaccinate their kids.
No.
And they were going on and on in this text conversation about how fucking horrible it is that they're sick with this thing that been prevented with one little shot. And I'm hearing the story, and I
would feel a little sympathy.
I feel bad for the kid, obviously,
I feel
because
bad for
the kid had no say in this. But like for the parent who's complaining that their kid has
I would have been like,
measles,
"What the fuck you shouldn't be complaining. Don't complain."
What the fuck? So hopefully
it's
this
like
is
meningitis,
right?
It's exactly like meningitis. Meningitis is so fucking preventable,
right?
And it's the easiest to spread.
But that's what I'm saying. Like, hopefully this anti-vaxxer thing goes away, because I get kind of where it came from. There was talk that there was too much mercury in the shots, and there was this thing for the longest time that autism was connected to vaccinations, which I think has turned out now to be totally not fucking true.
Yeah.
But it spread like wildfire because, the internet.
Yes, absolutely. And honestly, this is where I feel like the way that it's worded is just a ginormous like letdown sometimes, because if it's worded like wrong, like, hey, you know what, my son, like he was fine before, and then like he got a shot, and then now I feel like he might be autistic. You know what I mean? It's just the way you say things. It's just not the way that thing happens. And honestly, to be honest, like autism is like until 2 years old is when you can start actually noticing that there might be something probably a little bit.
Well, that's what people were saying. They were given the first line of shots, and then the kids
yeah, exactly. And it's like, no, it doesn't happen that way. Like, it's just you can't know. If that was the case, my son probably would have already had it.
Right.
He's just a little jerk.
You heard it from our nurse friend here on the show. Get vaccinated.
Yes,
get your kids vaccinated.
Please do. I don't want to have my son get measles because your son or your daughters don't have the vaccination.
Don't be a fucking moron. Okay.
Even us now. Like, for example, I just had to get my measles, my MMR vaccine, because you're only protected for so long.
Yeah, no, I'll get the vaccines. You know why? Because I don't want to die like they did 150 years ago.
Yeah. Oh, hell no. It's a horrific way.
There's just no need for it. Again,
I
don't want Valium.
No, you have a shot.
I don't want Valium. I don't want to be loaded up with a bunch of pills for cholesterol when I can just diet.
Yeah.
But for fuck's sake, don't get the plague, or not the plague, measles or whatever.
The measles,
For fuck's sake, don't get polio.
Yeah. Right now, plague is what we're calling the flu. That's what we call the flu, because it's like, oh my God. Sometimes it's, oh, sweet Jesus.
Well, given the fact that the plague is like coming back in Los Angeles, I think you should probably make the distinction between the flu and the plague, just so you know how to treat it. Can you fucking believe that the plague's coming back in LA?
I
mean, this will be a topic for another day, but
I know.
Jesus fucking Christ. When's the last time somebody died of plague? The year 1300?
I know. I was just like, what the fuck?
Man.
But then again, this also goes to, like, honestly, I feel like how you just said, like, the planet definitely does something, or releases definitely some things that it's just like, no, there's probably too many people here. We need to start just...
Probably, but that doesn't mean I want to be one of those people.
I don't want to be one of those people.
We have found a way to temporarily...
Hold it at bay.
Yeah, keep Mother Nature at bay, so why not?
Yeah, absolutely.
Unless you want to be part of the circle of life, and in which case, go do it out there.
Yeah, absolutely.
Okay, I got 2 more questions for you.
Okay.
And then we'll wrap it up.
Okay.
because I know you got things to do. I got things to do. How the fuck do you deal with like people constantly being sick or dying around you? Like, how do you go through that on a semi-regular basis, if not regular basis, especially in oncology is what you do now?
Yeah.
How do you see people die and go home and do the mom thing, the girlfriend thing, and all that? How do you deal with that? How do people deal with that in general?
I mean, every person deals with it differently. My patient that passed away, the one that I think I told you, the one that I was working on and stuff, and she passed away, and it was hard at that particular time. Usually, I really try my hardest not to bring my work home. I really, really do try my hardest. It is hard sometimes. I would just usually cry. Like, I usually try to cry like either on my own, because I don't want my son or my boyfriend to have that kind of, mentality like on them. So I would either cry on my own, or I'll just be in the car for a little while and I just kind of decompress and just, I have to remember like why I'm doing it, who I'm doing it for.
Is that something that you've developed over time?
That is something I developed over time.
How did you first deal with it when it started happening?
I got a counselor and I seeked help, because obviously it was the first time that had happened to me. And so I did seek a counselor, and I did talk to her for a little while, actually like almost a year, because it was really, really, really terrifying for me. But I had a counselor that helped me, and she was able to kind of give me a little bit of tips on how to control my emotions. And I do have to remember, like, these are not like my family members or anybody that I know. I treat them like if they were, but I have to remember that I don't have to carry like their kind of like emotional stress on myself, because it's at the end of the day, they are my patients. Yes, they are my patients, and I do treat them. However, they're not my family. It's something that it does hurt me. However, it's not something that would impact me as probably if someone was really close to passed.
Is there a danger, do you think, in becoming entirely numb to it? Do you have?
Oh yeah.
Do you find yourself needing to keep some of the humanity there, just so you can deal with it on a human level?
Absolutely, because I feel like if you're at the point where you have somebody that dies on you and you're just okay to kind of keep moving forward with the day, I mean, dude, do you even have a heart? Like, do you? Because I mean, this was a human life. Like, it was, whether or not you knew the person. This person belonged to somebody else. Like, that was their mom, their grandma or whatever. So it's that's kind of like how I see it sometimes. Like, fuck, like, I know it's not my family member, but it's someone else's family member. Yeah. And you have to call that, not you, but you have to, like, remember, like, hey, someone lost somebody that they obviously loved or whatever. But it at first it was a little bit difficult. Now I won't say that I'm numb to it, because I'm not. But I do a lot of like mental strategies to kind of help me, especially right now where I'm at in oncology.
Where you're probably going to see it a lot more often than not.
A lot more often. So it's something that I definitely not numb to, but definitely able to cope with it a little bit more, because I know, like, hey, some of them is just, unfortunately, that's just where they're heading to, and it's just, you can't stop it at that point.
I mean, we're all heading there eventually.
Yeah, eventually. Eventually.
We all just will have different ways of how we get there.
Yeah, absolutely.
I think it's good that you keep your humanity with it. I don't think you want to be a robot about it. No. I think if there's any positive I can pull out of that, just from somebody who could never fucking do what you do, is that we do have this fear of death, an unhealthy fear of death, I think, in our culture, in our American culture, where we do everything we can to avoid it. I would imagine the one good thing I would pull out of it, doing what you do, is getting used to the idea that it is unavoidable. Yeah. And learning how to treat it more as not the end of life, but a part of life.
Yeah. And that's definitely the best way to see it. If you see it as a part of life, because it is a part of life. I mean, it's easier to cope with a lot of things. And it's easier for you to see, like, oh, okay, like, unfortunately, it was just their time to go. It was just their time to go. Yeah. But also the way that it happens, I feel that's another that
probably
way.
Does play a big factor. Yeah,
that definitely plays a big factor to it. If, like, for example, the one that I was on top of, giving, like, chest compressions to make sure that, the patient was going to survive. And then for people who know what DNR is, the patient's, the patient's next of kin came in and was like, she's a DNR. So I stopped and I climbed off, and then that was just, we just had to wait until. So on those kind of cases, it does obviously still have an effect on you, because whether or not the person died, that's just what it is. Yeah. However, it's like, you feel maybe less responsible, I want to say, because it's DNR. You yourself, you just can't do nothing. Like, it's just, you just kind of let them do their own thing.
So is that kind of like, I don't, because it's your responsibility to care for them, but like if they're on that do not resuscitate list, does it make it a little easier to kind of walk away from it and be like, you know what, this was their thing, this was what?
Yes, it definitely is. Mentally, it is a little bit easier. You don't go home and be like, fuck, I could have done more for this patient.
Right.
Because, you can't. You physically cannot.
Well,
so that does make you feel, I don't want to say a little bit better or better. I definitely want to say that it is easier on your mentality for sure.
Well, like you have a hard job for way more reasons than just because people die on your watch sometimes. I mean, everything we've talked about, from difficult doctors, insurance, difficult patients, the fact that people die, the fact that people are sick, what you do is so incredibly fucking difficult. And I think that it's one of those jobs that is so needed, but that only a certain special few people can do. So, like, mini applause for you.
Aw, thank you.
For real, like, that shit's real, dude. Not everyone could do that.
Yeah, not everybody can. When people ask me, like, oh, I want to become a nurse, or, like, what do you recommend? For me, if you are doing it for the money, don't do it.
Right.
Don't do it because, one, you probably will hate it. And the hate that you have for your job will definitely, trickle down to your patients, and then your patients will suffer as well. If you want to do it because you genuinely want to like help people and that's something that you're really dedicated to, absolutely do it. But if it's only because of the money, I had a friend who asked me, she was going to become a nurse, and I asked her, why do you want to do it?
Yeah.
And you know what? Actually, I'm going to tell you, schools, they actually ask you, and they actually ask you to write a paper as to why you want to become a nurse.
Oh, that's good.
Whether you want to, and then you also interview before you get to well, at least the school that I went to. They interviewed me on the phone, and then I had to write an actual like paper as to why I wanted to become a nurse. And honestly, it's something that you need because you can see yourself, and not only you, but other people around you can see why you want to become a nurse. There's some people, I did remember my friend, she was like, the money. And I was like, don't do it. Yeah. She's like, why? I was like, don't do it. I was like, because it's not that simple. If you get to have a cushy job where you get to be like in the nurses, like for example, on the nurse line, yeah, because you're on the nurse line, you don't see anybody, you just hear what's going on. That's something, yes. But to get to that kind of particular level is something you're not going to get out of school and do. Definitely not something you're going to get out of school and do. They definitely want you to have experience. Because, I mean, if you don't have experience, how are you going to be able to give advice to somebody?
Well, how are you going to handle
how are you going to handle it? Yeah,
randomly and all that?
It just doesn't happen that way. So when I told her, I'm like, don't do it. And then I'm like, let me talk you out of it, and let me just show you why you're not going to be okay doing this job. And I'm like, okay. And I'm like, tell me out of like, and I gave her like a scenarios. I'm like, do you like blood? Do you like drawing? Do you like, just certain things that it's a day-to-day thing. And she's like, well, I don't like blood. I was like, okay, that's the strike one.
Well, yeah, you're out.
I'm like, you're out because it's like, I mean, I can't, when we have patients and it's like, hey, you know what? I'm not comfortable. Why are you not comfortable? Like something, but it's just like, I don't want to draw this patient. I don't want to see blood. Yeah. They're not going to hire you.
Nope.
Yeah. They're not going to hire you. Like I can do everything, but I cannot draw blood, or I can do anything, but I don't want to clean like wounds. Then why the hell are you here?
Yeah. Sorry, you don't qualify.
Yeah. Like it's just, that's just part of jobs. That's just part of your day to day. That's just what it is. Or like, for example, are you germophobic? This is definitely not the
wrong job
like,
for you.
Definitely not the right job for you. It's just not, no, it's definitely something you definitely have to consider a lot of things before you do.
Sure. We talked about a lot of heavy things, but I don't want to close the show with anything like that. Yes. I saved it for the very end.
Yay!
I want you to indulge us a little bit about your prostate milking story that you told me 2 weeks ago.
I hate you.
Yeah.
Okay, so this is at County. I'm telling you, County had like the best, that one and the urgent care that I had. That one has really horrific stories. That's actually way more graphic than County. But anyways, so County, my milking story. So I had a patient who came in who was complaining, of rectal like issues, and we're like, okay, well, we need to make sure that there's like everything okay. And then he's like, well, I've been peeing a lot more lately. We're like, okay, let's see if your like prostate is enlarged. We can see like what's going on. But the first clue should have been, because at County, you have male and female. And he requested for a female, and I'm like, okay, that should have been my first clue.
There's flag number one, everyone.
That was flag number one.
one.
So then, my coworker at the time, he's like, hey, he's like, he requested a female. He said he's just more comfortable. I'm like, okay, whatever. And you do get that. You do get that. For example, for me,
I'm one of those people.
Yeah,
I'm one of those people.
Yeah, you're like, for me, I'm one of those people too.
I'm like, it's awkward no matter what, but like, I'd rather a female do it. I don't know why. I've always been that way.
Yeah, absolutely.
I think there's more sympathy with females,
and you know what? For me, I feel that men
and their fingers are smaller.
No, men are just way more gentle. Let me tell you, I have
really.
Yes, for me, I prefer, especially an OBGYN, male all the way, male. They're just super, like, I feel like they think like that's like you're delicate and they're gonna be super soft and gentle. And with a woman, it's like, nah, I know what you can take. It's quite horrific.
Oh, maybe I'm just a masochist then.
Yeah, no.
Okay, but anyway.
Anyways, we digress.
He asked for a female.
He asked for a female, so I walk in, and then he was kind of like late 40s, early 50s, so he was like older already.
Yeah.
And he's like, I've been having like this pain. I'm like, okay, I'm just gonna check to see like the enlargement of like to see if there's any enlargement or whatever. And I'm like, I'm just gonna wash my hands first, and then like he like dropped trout like right away, and I'm like,
flag number 2.
I was like, okay, and then I'm just washing my hands, and in my head I was like, what the fuck? I was like, okay, I was like, whatever, and then I'm like getting ready, and then I start talking, and then he was like, okay, he's like, I'm ready, and I was like, okay, and he's like, but could you put some lube on? I was like, well, yeah, I was gonna.
Duh.
Like, I'm not gonna go like dry finger. And then, so then I'm like, okay, I'm taking care with my gloves. And then, I get the gel, and then I start feeling. And then he's like, could you not stop? He's like, I feel something there. And I'm like, okay. And then, I'm like, I'm just trying to like feel like to see if there's any enlargement. And then I hear like the paper rustling, like from the table bed. And I'm like, what the fuck is going on? And then he's like, but don't stop. And like, you can hear his voice is changing. I was like, oh my God, no. And then like right before I pulled out, like he like came on the freaking bed. Stop.
Oh my God.
And it was just the quickest thing. I was like, oh my God, I'm done. I was like, I don't even want to come back here anymore. I'm like, I'm just done.
So and that guy came to the hospital to get a free milking.
Seriously. And I'm like, and I told my boss, I said, you know what? I think I deserve to go home. I'm like, and it was like literally like 10 a.m.
Now, can every guy do that? Or
no, like you mean like
no, not like is it allowed, but like
yes, does it happen?
Massaging the prostate with that for every guy.
Yes. If I have one friend who does that for her husband, and it works every time.
Now there are people who it happens accidentally. I'm sure.
Oh yeah.
I imagine there's a lot of embarrassment.
Oh,
like,
absolutely.
Holy fuck, dude! I am so.
Yeah.
Fucking sorry, but then there's this guy.
This guy is gross, and I'm pretty sure he probably went somewhere else because we told him not to come here ever again. It was just gross, and he probably went somewhere.
I was like, ugh. He's probably gone to all the hospitals in town, just like,
so
you know what, I could really.
I just want to see if I have a prostate enlarged. It was like, ugh. And I was like, so if any like weirdo asks for a female to check for a prostate, just make sure it's not this gross guy.
Oh my God. Well, that's fucking hilarious that you
I know.
You milked a guy.
I know.
You did him a service.
Oh, I know. And I like
and he didn't even have to fucking pay for it.
I know, that little shit.
He could have at least kicked you like $40.
I know. I was like, you know what? I think I deserve something. Like anything. Like fuck, even a cup of coffee, something. I was like, Jesus. So gross.
I could just see you doing what you're doing, like, okay.
And you could see, you know my face. So it's just you could see my eyes.
And all of a sudden he's just like, oh. What did he say after it was done? Like, I'm sorry?
He's like, I'm so sorry. He's like, I didn't know that was going to happen. In my head, I was like, bro, you fucking knew, you fucking liar. I'm like,
oh my God.
You piece of shit lies. I was like, no. I was like, ugh. I was so upset. I was like, ugh. Like, I swear to God, I was like, I need like, it was so upsetting. You have no idea. I went home and I took a freaking boiling ass hot shower. I'm like, oh my God. I felt so violated. You don't even know. I threw away my scrubs that I wore that day just to like erase the memory of like everything that happened. I'm like, ugh.
I could just imagine that guy.
I know. And yes. And he made a noise. It was so gross.
He made a noise?
Oh, it was disgusting. Oh, God. Yeah. It was gross. It was that was my milking story. I was like, ew. I was like, no.
Now have you done that since?
No, I don't do any prostate exams on any men ever again after that guy. And I you know what? And I made that perfectly clear wherever I go. Like, I don't do that. I don't do that.
Well, I would say you have a very good reason for saying that is one thing I won't do.
I will do everything else. And I mean, I do really brutal stuff. So, But no, not that.
No, you have.
I'm like, I have paid my dues.
You have a good reason. All right, my friend. I think this is a good time to wrap it up. Thank you for coming on to the block. This has been an amazing conversation.
Thank you. I had such a good time.
Good. I mean, there's a lot we could talk about that we didn't cover. That maybe we can do for another one. But yeah, man, thanks for coming through.
Yeah. And thank you for the bourbon tea.
Of course. Again, this episode not brought to you by, but fueled by Bullet Bourbon.
Yeah, it was good.
It tastes good in coffee. It tastes good in tea.
It tastes great in tea.
So, again, man, thanks for coming by. And, yeah, we'll see you next time.
Bye-bye.